Good morning. It is my pleasure to serve as today's MC. My name is Lakeisha Butler, and I am the UF Health Chief Diversity Officer. Despite our pivot to a virtual platform, we have been looking forward to what this day represents, and what an exciting day it is. Thank you all for your presence as we commemorate the groundbreaking for the UF Health Urgent Care Center Eastside. This is a project that will have a long-lasting impact on our community, not only for the positive impact on the health of our residents, but it will also facilitate the long-term growth and development of this vital area in East Gainesville. Our program today includes some of the individuals who have played a significant role in this unique collaboration between UF Health, the City of Gainesville, and Alachua County. Though there have been so many more who have been pivotal behind the scenes to make this project a reality. We have all come together to tackle in an even more robust way the healthcare disparities that exist and have persisted within our community. Our goal is to partner with each other and with community residents in a collaborative effort to provide solutions for our patients that will enable them to achieve the best possible health outcomes and enjoy life to the fullest. Our facility, in combination with existing resources from UF Health, should make a real and sustained difference, and also serve as a catalyst to bring other resources to the area. Before we begin the program, please know that we welcome your questions for our panelists today and encourage you to submit them using the Q&A function in your Zoom toolbar. Feel free to submit your questions at any time during the program, and our panelists will address them during the Q&A discussion following the speaker presentations. At this time, I would like to invite Dr. David Nelson to say a few words. Dr. Nelson is the Senior Vice President for Health Affairs at the University of Florida and President of UF Health.
Thank you, Lakeisha, and welcome to those who were able to join us. This has been a couple of years of many firsts. This is my first event like this virtually. I did bring a shovel just so everyone could see, so we can put a shovel in the ground, or the virtual ground. But I just want to again thank the community and our partners for the support of this critical project. At UF Health, we often talk about our role in transforming people's lives for the better. Today, this really commemorates the opportunity to take a step forward in our belief for the residents of East Gainesville through the construction of this really important urgent care center. Along with our friends and colleagues from the City of Gainesville and Alachua County, UF Health is clearly devoted to working together to expand healthcare services in our community. As many of you know, we had a number of listening sessions in East Gainesville, and we are trying to make sure we're meeting the needs directly from the people of the community. One of the things we heard was that people really wanted a facility that was open beyond the routine hours, and we're trying to meet the needs of all of you and the families. We anticipate right now this urgent care center to be open 7 days a week, and we're going to explore extending hours well into the evenings. We're hoping this gives people in the community the chance to receive care without having to take time off from their jobs, or being able to access it on the weekends when there's an illness or an injury for kids in sports, or around family time. So hopefully we are listening, and we will continue to listen as this clinic opens and continues to evolve. The clinic itself is really exciting, 10,000 square feet of space. It's going to be quite expansive, featuring 8 exam rooms, 2 rooms that we can do procedures in, put a cast on, sew up stitches, things like that. There'll be x-ray facilities, And we're most excited, I think, about a community room where we can do a lot of interaction and education with the community, and I think offer some expanded services based on the needs. A couple that have been mentioned have been mental health services and some maternal health services. So I think there is room for growth. It's already been built in to the facility. Obviously, we're going to continue to talk with both community leaders and community members themselves, because we really want this to serve the needs of the community, and we'll continue to come back and ask you how we're doing, what works, what doesn't work, and we want to get this right over time. That's our commitment. We also really want this to not be a standalone project. This should serve as a catalyst. We need to bring in other development and other growth, get other businesses, medical related community, and really start to build jobs and other resources and services in East Gainesville. So I'm excited. I can speak on behalf of all of UF Health. This is the beginning, hopefully, of a new commitment in East Gainesville, and we're excited to partner with the city, the county, and the community. So with that, I want to pass this along and invite Anna Prizia, who's the chair of Alachua County Commission, to talk a little bit from her perspective about this wonderful opportunity. So thank you.
Hello, everyone. Thank you so much for having me today. It's really great to be here. On behalf of my fellow commissioners, I am really excited to be a part of this and to begin our process of action towards addressing disparities in East Gainesville and the eastern part of our county as a whole. With our partners at the City of Gainesville, we envision this multifaceted project to really be overall revitalization of this area. Between American Rescue Plan dollars and the Gainesville Community Reinvestment Area, which is contributions from the city and the county, and also the support and investment of UF Health in this project. It's a catalyst, it's a start to beginning that process of revitalization. I want to thank UF Health for rising to the challenge to agree to operate this clinic in East Gainesville. There have been significant challenges accessing timely and affordable medical services in this area. And this will really help by providing doctors that represent the community they serve and leading a lot towards reducing health disparities and the worsening health outcomes that we've been seeing. I hope that the partnership with the Department of Health and other programs like our community health worker program will also enhance the services that we offer in this area. Along with our investment in that community health worker program, I think that we are beginning to not only address the urgent care needs, but also promoting early intervention and preventative care measures, which are crucial to improving our overall community health and reducing those healthcare disparities and other fundamental needs that are going to require action, which is why I'm so excited about the city's EHEDI ideas, and that will also include things like affordable housing, an accessible grocery store, and other economic development and employment opportunities in this area. This project is one big step towards addressing equity issues that have long been under-addressed, and it will be a huge benefit to our residents' quality of life. And with that, I'd like to turn it over to Mayor Harvey Ward.
Thank you, Chair Prizia, much appreciated. Good morning, all. I am so pleased to be here on behalf of my Gainesville City Commission colleagues to represent the city of Gainesville and to mark this historic partnership between our city, Alachua County, and UF Health. I spent much of my childhood just a few blocks from here, across the street from the old tackle box, and attended high school at Eastside just down the street. I shopped with my grandmother at the IGA and with my mom at the Thriftway. We celebrated family birthdays at Monero's, and I ran errands to Lowe's and West Supply as a teenager. But for most of my life, I've watched investment, both private and public, pack up and head west. You and I have watched bank branches, restaurants, home improvement stores, groceries, and more close up shop on this side of Waldo Road for 40 years. We've seen infrastructure deteriorate and neighborhoods become progressively more empty. But all of that begins to end today. This is the beginning of an investment of more than $20 million shared between the City of Gainesville, Alachua County, UF Health, and the federal government in what we here at the city are calling the Eastside Health and Economic Development Initiative, or EHEDI. In addition to a shared investment of American Rescue Plan dollars to bring this much needed urgent care clinic out of the ground and into service for our neighbors, we have a commitment from the Federal Transit Administration to help us build a transfer hub for RTS next door to the clinic. We're investing GCRA dollars to build infrastructure on the same site and plan to attract more health and commercial partners as well as modern housing options nearby. Today, we begin a future of improved health and improved opportunity for our neighbors east of Waldo Road. Today, we begin a future of working hand in hand with our community partners and our neighbors. This is what effective partnerships look like. This is what community leadership looks like. This is what a promise kept looks like. This is what hope looks like. So thank you for this opportunity to participate today, and thank you all for being willing to work together to bring a full vision of health and economic development to East Gainesville. And with that, I will introduce Dean Colleen Cook from the UF College of Medicine.
Hi, thank you very much, Mayor Ward. And it's a pleasure to be here today. I'm really thrilled to be part of the program. It's a celebration not only for our city and county, but also for us at University of Florida. You may be familiar with some of our faculty and staff from the University of Florida College of Medicine in terms of being part of a local community through our family medicine Eastside practice on Waldo Road. As you've known, our clinicians really strive to create a medical home for residents on the East Side with a primary focus on primary care. This new facility is so important because it represents our steadfast commitment to continuity of care for the patients we serve. It'll improve access to care for those in the community, and it'll allow us to be able to expand the services that the College of Medicine provides, ultimately enhancing the health for really everybody in that region. So today marks the next step really to creating a healthier and happier future. I look forward to the impact this endeavor will have on our patients, providers, and our Eastside community. So thank you very much. Lakeisha, I think you're up next.
Thank you so much, Dean Cook, and to all of our speakers. Now we're ready to move into the Q&A portion of today's program, and we already have some great questions. Certainly, if you have any questions, please feel free to submit those using the Q&A function in your Zoom toolbar. Joining our speakers for the Q&A panel are some very important contributors to the UF Health Urgent Care Center at Eastside Project. So if I can have a few others to join us, we have Dr. Marvin Dewar. He is the CEO of UF Health Physicians. Dr. David Feller is the Vice Chair for Clinical Operations in the Department of Community Health and Family Medicine at UF's College of Medicine. We have also Brad Pollitt, who is the Vice President of Facilities at UF Health Shands. And now for our first question. Can you discuss some of the major concerns brought up by the public during community listening sessions? And what were some of those main concerns, and how will they be addressed by UF Health and involved parties? So I will welcome anyone who would like to answer that question.
Hey, Lakeisha, I'll take a first stab at that. I think I'll focus on a couple of things. A number of people ask us, about the scope of services that we're going to be at the Eastside Urgent Care Center. And so we've addressed those by, broadening them as much as we can at such a center. Not only will it have the usual kind of ability to take care of primary care problems, but maybe more importantly here, if you've got an injury, a minor injury, a sprain, a strain, a laceration, those kinds of things after hours, this center will have the ability for you to walk in without a schedule, and get those types of things taken care of. So scope of services was one. Another that we heard a lot about were the hours. When were the right times to be open? And the truth is, we don't know for sure at the moment what those hours, the right hours are, because we've got to get started and see when people arrive. But we are going to start 7 days a week for 12 hours a day. We have committed to monitor when people come and how many come at the beginning of the day and at the end of the day, to share that with the community and then adjust the hours depending upon what the actual results are. And I think a final issue that was brought up was, and both Commissioner Prizia and Mayor Ward spoke to this when they said that this is a start. It's a good start, but it's only a start. And so a number of individuals made the point that, an urgent care center on the east side is not the be all end all of healthcare on the east side of Gainesville. And there are needs in mental health, there are needs in dentistry, there are wellness, education, and nutrition needs, all of those. And we agree with that. And so at the same time, we are making this good start. We're going to continue the dialogue with the community on what the next steps are and what services we should continue to add.
Thank you, Dr. DeWar. I will just add in, there were questions regarding the acceptance of various insurance. So we did mention that all insurance will be accepted, including Medicaid and Medicare. There were also concerns regarding supplier representation. So Brad, would you mind speaking to that process on how we are addressing supplier representation from the community?
Sure. We've hired our contractor, and they've gone through the subcontractor list. We've looked throughout the Gainesville community and East Alachua County and tried to bring in any local subs that were able to supply materials and services. They've done a pretty good job of trying to bring all of those elements to the table. We also are looking specifically at long-term service contracts. So ongoing, not just construction, but this will obviously go on well into the future, and looking to expand and make sure that those contracts are representative of the community.
Okay, thank you. We did have a question regarding the projected days and hours of operation. I believe Dr. DeWar did mention that the clinic will be open 7 days a week, and we are still confirming the hours of operation, but this will definitely be an expansion from primary care services. Another question that we have is, where did the initiative for this center begin?
Yeah, I think that's a neat question because in many ways, the idea for this bubbled up in multiple places at the same time, and it was the right time for the confluence of all of those things to come to play. So I remember sitting in meetings at UF Health where we talked about the need to expand services on the east side of the county, how to do that, how to get started. And then at the same time, both city and county were having conversations about the need for, increased services of a variety of types on the east side, including healthcare. And then along with that, the community was reaching out for that. So a piece that tied it all together was then the availability of these Federal Recovery Act monies, which could be used only for certain things, but an initiative like this was one of those things. And so with all of us having the idea for this as an important set of services, a collaboration occurred that, as far as I know, hasn't ever happened before in exactly this same way, and is pretty special. So the idea belongs to a whole bunch of people on this call and a whole bunch of people that are in the listening audience too.
Yeah, I guess I would like to chime in and just ring one person's name out. and that is former Commissioner Gigi Simmons. I think she really spearheaded a lot of the championing of this project early in its infancy and was a big part of the reason why these conversations got started. And I think, in her, in her new role out in the community, she's also been a great advocate for expanding healthcare services on the east side and was instrumental in the early efforts to also develop our community health worker program, which we hope will be used by many of the facilities throughout our community. We are training community health workers and certifying community health workers that can be placed with any facility to do follow-up, to do things like medication compliance, to answer questions post-visit, as well as make visits to check in on some of the issues we talked about, like nutrition, maternal health, things like that. So those will be great assets to facilities like this one and others. Our health department is another one where folks that represent the community and have training in healthcare can go out into the community to meet people where they are and have those conversations and follow-up discussions from their doctor's appointments.
So thank you for that. We also had a comment from Gigi that states, as the former District 1 commissioner that spearheaded this project, she would like to acknowledge all those who made this possible. And this indeed was a labor of love and much needed resource. So thank you very much.
I would say that every time we have a meeting about this, she is always there. She never misses. She always contributes. And she has promised she's going to stick with us until the end as we kind of figure out the next steps.
Our next question. UF Health recently announced a strategic vision themed Life Transformed. How will this project advance improved health outcomes in the community? Is there someone that would like to tackle that? Dr. Nelson?
Sure. I mean, Life Transformed has many meanings. In our case, what we can hope to control is the health of people and their families. And I think Anna highlighted that we know there are tremendous health disparities. In other words, different outcomes depending on your zip code. If you live in East Gainesville, you're probably more likely to have challenges with hypertension, diabetes, and other diseases that can be impacted with education, nutrition, and full access to good healthcare and consistent healthcare. And so for us, we are in a conversation about not just saying we're going to change people's health, but actually developing the metrics. In other words, what are the markers that we can follow? What are the rates of diseases, the rates of hospitalizations, the rates of different things that are meaningful to you, to us. And so, I think we could also use a conversation with people to understand what are the important outcomes that the community in East Gainesville would like to have life transformed, which sounds nice, but has different meetings, I think, to everyone. So in other words, we hope, this is one step, right? Marvin Dewar talked a little bit about a lot of the potential needs in the community. I think access and consistent medical care are going to be the keys. And so one of the things that we need to do, and we've done, is make sure that if you get seen in this urgent care, you have connectivity and you have a primary care doctor that's going to follow up. And it's not just kind of a one and done. And, oh, your blood pressure was up, we quickly got it down, and now what are you going to do? Or, you broke your ankle, oh, by the way, your kind of weight is going to be an issue. Let's get you into some kind of diabetes, nutrition, education type services. And I think, again, we need to track data. We're all really good at announcing big initiatives, but we hope to develop the type of information we can continuously feed back to see if we are making a difference. And for us, they're going to be healthcare related impacts on allowing people to live a healthier and longer life.
All right, thank you. Our next question is from Mary Ellen Willer. How will people be able to have access to pharmacy? Will there be the provision of basic medications, or will there include a pharmacy on site? Is there anyone that would like to share? Dr. Feller, Dr. Dewar?
We have not included a pharmacy on site as a part of the planning. That there are, of course, pharmacies in existence in the local area that match the hours that we're going to be open, and we certainly probably need to maintain a list of those that are open, in the extended hours in the evening and on weekends, so that we can let people know when they attend the urgent care center about those pharmacies. The question probably is something we ought to talk about as a group. I'm looking at Dr. Feller because we haven't talked about this, and there are ways you can vend a certain number of medicines to people on site, and whether or not that's a good concept here or not, I don't know. But whoever the questioner is, Lakeisha, you can credit them for starting a conversation among us about what we should do.
Yeah, Dr. Dewar, if I can just add on to your comment, what we've done at our emergency rooms is we've established kiosks, which make available routine medications that people can take on their way out of visiting emergency rooms. So that may be a similar concept that we can employ at the urgent care center, but definitely a great topic, and we will definitely follow up on that.
Yeah, Jim, that's kind of exactly where my mind was going. We hadn't talked about that here, but you do use that in your EDs now. I think it has been a real success, and so this may be another place to do that.
And I would hope, Mayor Ward, I may be speaking a little out of turn, but I think that one of the ways that the CRA, the city and the county are collaborating on the CRA, is to make shovel ready this site for other facilities that would be supportive and complementary to what's going in the site. And so hopefully as this clinic develops, we can work with some of the other pharmacy providers to explore attracting a pharmacy here. That would be a fantastic addition, I would say, to this site, along with a grocery store, something where people could access fresh, healthy food, perhaps even fulfill a prescription for healthy food someday. As well as other facilities, dental care and things like that we've talked about expanding as we get our feet under us with this facility.
That's right, Chair Prizia. We're planning to build out the infrastructure, and including potentially pre-built pads ready to go for further economic development. That's really the long-term plan here. We love the clinic. It's wonderful. It's a huge service to the community, but it's only the beginning. I anticipate tremendous growth. It's about a 15-acre complex, the full Eastside complex. So we expect great things to sprout from this.
And there is RTS service. You all will be building a hub there, correct?
That's correct. There's a question I saw that. The question if it will be served by RTS routes. It won't just be served by RTS routes. We have a commitment from the Federal Transit Administration for a $4.1 million grant that will help us build an Eastside RTS transfer facility, full transfer facility right there in on site at Eastside.
Thank you. It looks like we have another question. How will this facility help the College of Medicine and all of the health colleges at UF Health meet the growing need for more healthcare providers?
Well, I'll start to answer that question, then I can have Dr. Nelson speak to our nursing and public health. Our students are so excited to be able to partake in this, and we hope to inspire more of them to go into primary care and stay in Gainesville. A number of them work at the Equal Access Clinic, which is along the east side. Our students started that. Dave can correct me, or Marvin, maybe 30 or 40 years ago. It was one of the first, or Dave Feller, in the country, and its participation rate among our medical students is 98%. So our students are really excited to have yet another opportunity. We also manage the Physician Assistant Studies School, so that's in the College of Medicine, and our PA study students also go to the Equal Access Clinic and are very excited about opportunities. So they're all knocking at the door about when this will open. So it'll all be very good. Dave, do you have anything, or Dave Feller? Maybe.
Yeah, I'll just add on. Obviously, we have a number of colleges that provide healthcare personnel for communities, nursing, mental health services, public health folks, College of Dentistry. Our vet school has, the St. Francis Clinic and other activities. So I think there's a two-way opportunity. One is a number of our trainees and clinicians can rotate through this clinic. I think the other opportunity is to really help build job skills and opportunities for employment pathways for residents of East Gainesville, similar to what the hospital has done with a number of training programs out of the East Gainesville school system. So I think, this is just an opportunity to not only bring services to East Gainesville, but hopefully develop some innovative training programs to help excite young folks from the East Gainesville community into healthcare professions.
Dr. Feller, did you want to add anything?
I was just going to add that as both Dr. Cook and Dr. Nelson said, the opportunities for both learners and for people in the community to go on job tracks and things like this is really kind of exciting. Just echoing what they've said.
All right, thank you. Another question is confirming the reason for an online groundbreaking. So certainly this was not something that we had hoped for. It was disappointing to have to pivot to the virtual platform, but we wanted to be safe as relates to the weather. And of course, you just never know with the weather. And so it was expected to not be favorable. And that is the reason we did pivot. It was very important for us to have this event in light of the inclement weather. And so here we are. I don't know if anyone wanted to share any other comments. Right. Another question from Commissioner Cynthia Chestnut: will weekly education classes be offered to the community on health issues such as diabetes, heart disease, wound care, and so on?
I'll just make a quick point, and I think I'll have Marvin follow up. And even if Gayleen would like to comment, we've had a planning team around the community room, and with feedback from the community, we would love to see a large part of the room be there for any healthcare. It could be diabetes, hypertension, smoking cessation, healthy eating. Gayleen, do you want to list any of the other things that from the feedback from the community that community room in terms of planning?
Absolutely. Thank you, Dean Cook. Yes, we've received amazing feedback from the community, and some of the programming that we currently have in the works right now is family and food nutrition programs and education. Definitely wellness and mental health was a big topic of discussion. So we're partnering with a couple of folks in our community and with the college to provide those type of programmings. Caregiver support was something that we talked to the health department about, that we were also interested in providing some sort of a support group sessions weekly for folks in the community. Diabetes management and hypertension education is also key. And then we wanted to also add some educational components. So as developing a 4-H group, or we also plan to have a community healing garden, which we plan to have educational sessions for our students to talk about fresh fruits and vegetables and different ways for healthy living and healthy eating. So thank you, Dean Cook.
Yeah, I would give a shout out to Gayleen, who has taken this on as a mission to make sure that that community room gets used the way it can be. I think it's very important. It's not just an afterthought in this urgent care center that there is this community space. It is really the intent that this be, not only a medical facility where you come and get medical needs met, but that it's more than that, that it's a community kind of gathering place and a value add place. And if our dreams come to fruition, and I'll share our dreams about this here, we would come back in 5 years, and about a third of the community room would be used almost all the time, right? With a third or so of its use being things that you will think about as a straight medical, diabetes and hypertension and anxiety and depression. A third of it being, other educational topics that the university or IFAS or others can bring to bear that might not initially have been thought of as just medical. And then a third of it being used by the community members themselves who say, we want to schedule and use that community room for this group or that session or that topic. And so we're going to intentionally try to make it a room that gets used a lot and gets used in a lot of different ways.
Great, thank you. Looks like we have a few more questions. Can you talk about recruiting physicians or doctors that represent the patients that they serve? That was a big issue for the community. So recruiting doctors and staff that represent the patients that they serve.
Lakeisha, I'll connect with Dave Feller. So our Department of Community Health and Family Medicine will be the department that is spearheading providing our physicians and caregivers, advanced practice providers, those are our nurse practitioners, and physician assistants and staff. And so I'll let David Feller speak to that, Dr. Feller, who is the lead from the Department of Community Health and Family Medicine. So it's all yours, David.
Sure. That would certainly be ideal. There are shortages of physicians and providers across the country right now. So it'll be a challenge, but I think that anything that we could do, there's plenty of studies that show that, especially in a community setting like this, having a provider that is closer in representation to the patients they serve builds trust. And so, yeah, anything we can do would be ideal.
And I'll just make I'll pull Gayleen was one of my senior project managers, but so I will speak a little bit more to this. We have amazing toolkits that we've developed for diversity and hiring of physicians and care providers in the College of Medicine. Gayleen spearheaded some of the toolkits that we have for departments to be able to launch and recruit folks from diverse backgrounds. I can also speak to equity advisors that we've trained up, and Gayleen is also one of them for our search committee. So we have a big master plan on recruitment and retention of faculty. Gayleen, do you want to comment at all on the toolkit that we developed?
Yes, thanks, Dean Cook. So wonderful toolkits that provide some intentionality in terms of how we look to recruit for this amazing urgent care service. But in addition to that, we are also planning on having a job fair. So I also serve on the operations teams that will help support and build out this facility. And so we're partnering with the hospital to actively and intentionally recruit within our communities to help fill some of the need that we have for this facility. So really excited, lots to come. And so we're really looking forward to building this relationship with our community.
Thanks, Gayleen.
Thanks, Gayleen, for mentioning that job fair. As it has been mentioned, the intentionality is certainly important. So we are discussing this job fair being held in East Gainesville to recruit staff members potentially for the clinic. All right. Next question, will patients who use the urgent care center be referred to the UF family medicine practice that's in the neighborhood?
David, I'm going to let you take that as our lead here for the department.
Well, I think we would refer them to wherever we feel they can get, the best care. And sometimes proximity is an issue. We do have clinical sites on that side of town. But I think the general feeling would be we refer them to wherever they can get the best care.
I think one thing I would add to that, Lakeisha, is that this urgent care center, there won't be a requirement that you already be a patient within a UF Health practice to come to this urgent care center. People will be able to walk in and get care if they come from one of the UF Health practices, if they come from another physician's practice in the community but want urgent care services, this is a place they can get that. Or if they don't have any other primary care services at all. And certainly if someone comes to our center and already has another primary care physician, even if it's outside of our system, once they're seen, they will be encouraged to go back and see their primary care physician. If they come to the urgent care center and don't have a physician, we will try to help them get a physician. And the best way we have to do that is with one of our own primary care sites. And then I think the last thing is that, and Dean Cook mentioned this earlier in an answer, we have the Equal Access Center and the Mobile Outreach Clinic that have been working for years, but maybe not always connected with one another and connected with the practices the way that they should. I hope this Eastside Urgent Care Center can be a connector that both receives patients from those two practices and then uses those practices sometimes to help patients get follow-up who need that.
Great, thank you so much. Looks like we have one more question. In what ways is this approach working in concert with the city and county unique? So how is this collaborative approach unique? Mayor Ward or Chair Prizia?
Sure, I'm happy to take that. This is unique in that we simply haven't had anything like this before. What we're doing is the city and the county are both using $2.25 million each of American Rescue Plan funding dedicated to this project. We're funding the bulk of the construction, and then UF Health will be operating for the foreseeable future. So everybody has some skin in the game. Our institutional partners are all front and center here. And while we all tend to work very well together, this is different in that it's actual resources, and it's actual resources committed to an area of Gainesville that doesn't see that sort of thing regularly. So, this seed basically is what I consider this. The clinic is great. It is wonderful. I don't want to diminish the value of the clinic at all, but it is the seed for so much more that's going to go in there. And I anticipate being able to leverage more and more partnerships on this in a way that we simply have not done in recent history.
Well, I think it's important to state that the building is expected to be complete a year from now, so June of 2024, and opening and staffing will occur in July. And so we are certainly excited. This definitely commemorates the beginning of the construction that will be complete in a year. And so I would love to thank the speakers, our panelists, for all of your comments, and certainly all of our attendees for your presence. At this time, I think that we will conclude our program if we don't have any further questions. But we look forward to the continued partnership. We look forward to the continued listening sessions in the community. This is a joint effort, and we are looking forward to the journey ahead. Thank you all so much for your presence.